Let's talk now to Ranu Bogle, who's Director for Policy Research and Campaigns at Oxfam India. Thank you for joining us. What is your experience of what this lockdown is doing to people in India?
You know, I think people were waiting for the lockdown to be lifted today. And now with this extension till 3rd of May, people are going to get very desperate. You know the stories of the informal sector workers, the migrant labor starting to walk back home when the first lockdown was announced. And they started with whatever meager savings they had and whatever they could get in terms of wages. Now that money has run out, they've been stopped midway. They have not been able to reach their destinations. The feeding is being done, including by Oxfam, by a lot of philanthropists and NGOs, some places by the governments. But supplies are running out. There is shortage of food. The heat is picking up. There is going to be increased demand for drinking water and water for hygiene. So I think the situation is going to get pretty desperate now.
And is the planning in place to provide those much-needed resources?
So, you know that the Prime Minister spoke to all of us. He has not mentioned any plan. He has requested the people to, bear the cost and people to feed the poor and, not stop wages. But there is no new package announced by the government. There is total lack of clarity how these people who are stuck in different parts of the country, how we are going to handle them. Testing hasn't started on a large scale, and that's something that's required because unless we test, we will not know the extent of the disease, how much it has penetrated our system. So, I mean, there's a lot of uncertainty. There is a lot of, I would say, a talk about, coping with the crisis and doing it for the nation. But the reality is that people are hungry. A lot of people are hungry. And there is little food. The supply chains are disrupted. So the supplies are running out now. And we are really entering a very, very difficult phase, I would say.
You talk about the temperatures are rising, the weather changing. We're talking about so many people who share facilities, toilet facilities, water facilities, for whom presumably social distancing just can't happen.
No, it cannot. And you would have seen visuals of today also when migrant labor rushed in Mumbai to the railway station because somebody said that trains will be running to take them home. And you see the numbers. And most people live in very, very congested slums and settlements. Even the lower middle class and middle class colonies are not exactly like spaced out. So social distancing is something that India with its numbers is not easy to practice. And as I said, I think water is going to be a huge constraint in maintaining hygiene and and drinking water shortages. So this is going to be serious.
And when you say this is going to be serious, a lack of water, a lack of anything like that can lead to rioting.
Totally. Even in normal times, in the slum settlements, there are often cases of, fights breaking out because a water tanker comes and many people want to collect water from that one water tanker, and fights do break out. Now, with the emotions being on people are stressed. They don't have jobs. Their money is running out. Food is scarce. And likely that we'll have a scenario that people will be fighting and there'll be, huge stress in the system, basically.
And there are already reports of fighting between those who don't have the virus attacking those who do.
Yes, and we have heard of cases where especially the health workers have been ostracized by housing societies. Some of them have asked them to vacate their houses, that you will bring the virus to the colonies. Of course, a lot of appeals are made that please don't do it. But a lot of incidents are also not getting reported. And even in colonies where cases are getting reported, the neighborhood is not exactly compassionate towards people. I mean, all it needs is quarantining and supporting them to the extent possible, but that's not happening. So, I think somewhere the society is losing the sense of compassion and care, and it is all about me and my survival and my family, which is not good as a society.
Ranu Bogle, Director of Policy, Research and Campaigns at Oxfam in India. Wish you well with your work. Thank you very much for your time this afternoon. Thank you.
Thank you. Thank you. Bye.